Hello, everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins. As you should know, our show is dedicated to giving you safe and effective natural ways of helping to treat many different medical problems. I want to start by thanking our two sponsors, Doctors Biome, doctorsbiome.com, doctorsbiome.com. Doctor's Biome makes a very special probiotic beverage. Now, why it's going to be important to people listening to this show, Sickle Cell Disease, is because the gut connects to every organ and every system in our body. So it's essential to have a healthy gut. So you want to go to doctorsbiome.com. And right now, I know they're already back ordering. I don't know when you're going to get to listen to this show. They're always back ordering it because it's being sold around the world, made in small batches. It's a living probiotic beverage. What makes it different from capsule powders and tablets are that capsule powders and tablets are destroyed over 90% in your stomach, if not completely. And hopefully some of the bacteria will come out of suspended animation, grow into adults, and populate the wall of the gut. Well, Doctor's Biome is living in all these 15 proprietary patented strains are living in a 100% organic mint, kale, lettuce, celery, cucumber, apple juice. So they're apple lemon juice, actually. So they're growing in number every day. They're alive, wiggling around, doing what probiotics are supposed to do. And when they reach your stomach, they survive over 90% and stick to the wall of your gut because they're called next generation smart probiotics. They're actually designated, made to do just that. Nothing is like it on the market. It's its own unique product now. Nothing compares, and it's delicious. Babies, children love it, and they need it just as much as adults do. So when you go to doctorsbiome.com, because not a cheap product, put in my patient coupon code Howard35 and you'll get 10% off the retail price. And it comes with a 100% money back guarantee and free shipping. So you definitely want to do that. And if you go on auto ship, you get an additional 10% off. Doctors Biome, doctorsbiome.com. Then I want to thank PromoLife at promolife.com, promolife.com. This is very important to this show because you can get set up for home care ozone therapy because you may not be in a place around this country where you can get what we're going to be talking about to treat sickle cell anemia. So you're going to want to get set up for home care and home care ozone. So, and you'll learn all about it when we do the show. So the rest of the show. So you want to go to promolife.com and you best call them at 888-742-3404. That's 888-742-3404. Tell them you heard about it here on Dr. Howard's show and you want to get set up for home care, and this way they can discuss it with you, and you'll learn why on this show it's so important to be doing that, where you can't get intravenous ozone in the non-blood methods, as you're going to learn about. So you call them at 888-742-3404, and they'll actually give you something off the retail price. They treat you very special when they hear that you were on this show. Okay, so let's get right into it. Sickle cell disease, it's a very rare inherited blood problem in where your red blood cells aren't round. They have sort of a sickle cell shape, like a little piece of the moon, as they call it. And this causes serious and sometimes even death. I mean, you can die from it. People with sickle cell, you're born with it, basically speaking, because it's a genetically inherited disease. Now, you wouldn't think it's that serious because how many people get born with it? Is it very common? Well, technically, yeah. You have over 100,000 people with it. That's the current government estimate. I think it's way higher than that. Just here in the USA and around the world, wow, more. I mean, you're talking, I don't know, maybe 1 million people. In this country, in the USA, over 2,000 babies a year are born with it. It is sad. Everybody knows how I am about kids. I got 7 grandkids. And it's very serious to me when you have a little baby born like this. They can't fend for themselves. So just to give you an idea, 1 in 13 African Americans carry this sickle cell trait. And many don't even know they have it until something happens. Latinos are the second most common, have the second most common, but that doesn't mean anybody can get it. Indians, I don't mean Native Americans, can commonly have this also. And one of the things I found out from doing one of those genetic testings that one of my kids gave me for a holiday gift some years ago is that I actually have African American, African descent. I have a common birth mother from 10,000 years ago. So yes, Caucasians can get it too, can have it also. It's not just limited to people with dark skin. And I'm a little bit dark because I was in Mexico for a week and a few days just recently, having a little rest and relaxation time. And I tan very easily. And I believe after finding out from that genetic testing that I have a common African birth mother, it explains why I tan very easily, as do many people with even like I have Eastern European descent. Throughout Europe, a lot of people tan very easily, just like I do. And I think it's all because so many of our ancestors came up from Africa. But that's another show if you want to talk about it. So let's talk more about this. So just very quickly, normal red blood cells are round. They're soft. They contain hemoglobin A, it's called, and they can easily, they're very able to change their round shape to squeeze through narrowed, clogged, and hardened arteries better. And they live for about 3 months before they die off. Senescent cells, we're always putting it out. And and basically they get replaced by new blood cells. That's how we live. Well, sickle cell patients, people with sickle cell, they contain hemoglobin S. They become stiff and even hardened at times, and it distorts their shape, and it makes it so they're inflexible or less flexible. They can't slip through narrowed, clogged, and hardened arteries better. They live only for a couple of weeks, maybe, 12, 15, 18, 20 days max. You can have it where you don't even know you have it. It can be chronic. It can be severe. It can cause unpredictable pain, severe anemia where you can suffer from it all the time, or mild anemia where you don't know why you feel tired and fatigued some of the time, more so than you should. I mean, a simple blood test can determine this. Some of the patients with sickle cell that we've seen get frequent infections. Their growth may be affected. They can have many different problems. And in severe sickle cell disease, in the disease, not the trait only, you can have complications where you wind up in an emergency room because of what takes place. Now, the show, I used to go into a lot more about all the details of the disease. If you've got it or you have the trait, definitely you want to do something about it. The number one thing to do about it is intravenous ozone therapy, and not all forms of it, only the direct intravenous ozone therapy. This is where we push oxygen and ozone gas directly into your veins. Don't get nervous. It's not air. It's not going to kill you. As of the date of this show, so you can look up when it was first published, I've done over, in my clinic, we've done over 385,000 direct intravenous ozone therapies over the last 30 of my 35 years doing intravenous ozone, 385,000 proving its benefits and its safety out of over 430,000 total treatments, where in the other methods where we generally take out blood ozonated and put it back in. You don't want to use those blood methods of ozone. So anytime you're going to look it up and you're going to find out from a doctor, how do you do it? If they're going to take blood out, ozonate it, and put it back in, it's a no-no for this problem. You don't want blood coming out of your body, and hopefully it's going to get transfused back in. Okay? This is where we push the gas directly in. And while it has so many benefits, because many people with sickle cell get frequent infections, this is going to destroy every virus, fungus, yeast, mold, bacteria, parasite, toxin, and harmful free radical in your body. So it's going to cleanse, detoxify, and boost your body up. You know, if you listen to our show called Intravenous Ozone Therapy, Everything You Need to Know, it goes over all the different methods and why we use the most powerful ones that I believe, and more description about the direct IV treatment. It takes only a few minutes. It's real easy. It's obviously been proven safe. We've never had anybody suffer from it. And worldwide, other than the blood methods where they're, all fairness, a few compared to traditional medicine, just 4 or 5 recorded deaths from the blood methods of ozone. There have been no recorded deaths when direct IV is done by a medically trained healthcare professional. Please don't go and find ways to get the supplies and the machines and everything and set yourself up to do this at home because you saw some idiot who posted something on the on YouTube showing you how to do this. This is meant for only medically trained in direct IV ozone healthcare professionals. And I've trained dozens and dozens of doctors worldwide in it. So you want to do at least 36 to 48 treatments of this, done at a minimum of 3 times a week. Take only a few minutes per treatment. And this is going to set you up, and then you want to be coming in regularly. Remember, this is a genetic disease. Every 2 weeks, give or take, or 2 to 2.5 weeks or so, you're making new red blood cells, which means you can make new sickle cells. And we want to constantly be making the red blood cells rounder so that you don't have strong episodes that may of thalassemia. It's also called thalassemia major and minor. Now, thalassemia minor, sickle cell anemia, when it's the trait minor, you may not even know you have it. But in thalassemia major, then you may have already wound up in emergency rooms. Where you can have seizures. You know, remember, each red blood cell has to have 4 iron molecules on it. That's unless you're iron deficiency anemia. And each iron molecule holds 4 oxygen molecules. So each red blood cell, technically, if it's a healthy cell, with enough iron, can hold 16 oxygen molecules in the arterial blood. And that's why when it gets to our cells, it combines with sugar using the organelles in the cells called mitochondria. And this is what creates your ATPs, your adenosine triphosphate, your energy molecules, your adenosine triphosphates. And so with direct IV ozone, it actually helps your mitochondria uptake more oxygen. So if you have adequate diets of complex carbohydrates, you're going to create in your blood healthy sugars that will go to the cells because ozone helps in blood circulation and direct IV by opening up clogged, hardened arteries and the microcirculation as well. So it helps in the delivery of nutrients and oxygen. More oxygen can be can be picked up and utilized then by the mitochondria to make more energy. So all these are positive things for people who have sickle cell trait or sickle cell anemia. And this is the primary way to do it. Now, I said home care. For some of you who can't get IV ozone, direct IV ozone, then you may want to do home care. Home care is, in this case, one thing and one thing only: rectal insufflation. It's an ozone enema. So PromoLife will set you up with their basic elite machine with an oxygen tank that you hopefully will be able to get refilled in your neck of the woods. I recommend not medical, but commercial tanks for that. And then it's still the same medical grade oxygen. It's just how the tank gets filled. A commercial tank has threads on it that make it look like it's, you could screw a garden hose on it. Different from a medical tank, which requires special regulators. And depending on where you live in this country, legally, technically, you need an MD's prescription to be able to get an oxygen tank and or an oxygen, I should say, refilled with oxygen. Tanks you can get, but to get it filled with oxygen, that's the trick. So bottom of it all, ask for, and PromoLife, if they told you I'm sending you, should know how to set you up for this, okay, for home care. Well, you want to do rectal insufflation, which is basically an ozone enema. Now, we've done shows on ozone home care. You might want to listen to that to learn all the ways you can use your machine. But an ozone enema, you want to wet your colon first with some purified or distilled water. You could use a bulb syringe. Sometimes you can get what they call a fleet enema, and FLEET, and that just puts water in, washes everything out, and wets the colon wall to some degree so it can absorb more ozone. It's not the equivalent of intravenous ozone therapy. I wish it were, but it isn't. Otherwise, that's all I'd be telling you to do. But you could be doing that twice a day, every day, if you have sickle cell trait or sickle cell anemia. And that would, even with direct IV ozone, and that would be very good. I can't give you specifics because I'd have to know the individual specifically to tell you more or less how much and things like that. But it can be done to babies as well as children safely. But you want a medically trained doctor who's skilled and knowledgeable, both academically and clinically, with the use of ozone therapy to advise you on how much you as an individual should take or how much to give to your kids if they're the ones that need it. Now, there are other things so that's it. That is the ideal, the number one way of treating this very serious problem and even saving lives from it. Many people with thalassemia major die young. It's a very sad thing. And here's a way to potentially save their life. There have been lots of studies done on sickle cell anemia, and I have my notes here on some of the things that are very, very important to note. So, things that have been proven beneficial: vitamin C. In addition to the probiotics that I mentioned earlier. Vitamin C, you need to take it 5 or 6 doses a day. The amount is less important than the frequency. And please don't buy cheap vitamin C. You have to buy vitamin C that's highly absorbable, highly bioabsorbable, bioutilizable, and bioavailable. That means your gut can absorb it. That's why you need a healthy gut. Your body, once it's in your blood, the cells, it's available to your cells, which can take it up. And then once it's in bioavailable, and then bioutilizable. That means your cells can actually use that form of vitamin C. It's all not created equal. So better vitamin C's like the liposomal C's and sometimes even the buffered, some of the buffered powders are wonderful. So you don't have to just take capsules. You can do buffered powders, particularly for babies and children. You don't need a lot, as much as you need the frequency, because it's in your body 2 hours, it's used up, and the rest is urinated away. Vitamin E and beta carotene have been shown by many studies to help with this problem. Um, Many of the patients have decreased amounts of glutathione and glutamine. And when you're getting direct intravenous ozone, you can be using what I call a Robin's glute sandwich. That's half your ozone, then the glute, and the other half of your ozone. So we make sure that glutathione can get in you. While you may not be able to get ozone therapy nationwide here in the USA, intravenous glutathione is available very commonly. So that may be something you want to do. Let me think now. One study showed that eating Brussels sprouts can be very beneficial. They found that sulforaphane, which found in Brussels sprouts, can make a big difference in this. Beets, arugula, celery, lettuce, radishes, spinach, all healthy foods to eat if you have sickle cell because of the things that it can do. Spirulina has been proven, N-acetylcysteine, alpha-lipoic acid, citrulline, all those supplements you can be taking on a regular basis. And you can do it simple. If you want to do some juicing from green leafy vegetables in general, you can't go wrong. You can add, and beets will give it a little bit of sweetness, but it's all these plant-based nitrates are very, very beneficial in this. Aged garlic extract, although I like raw garlic myself. Aged garlic extract and black tea and green tea extract, pycnogenol, all very important in this. CoQ10, beta carotene, all very important supplements that you should be taking if you have this. Quercetin, hawthorn berry extract, all very, very helpful and beneficial for this particular medical problem. And oxygen therapies in general. If you're having, if you've ever had any attacks, try to get your doctor to write a script for oxygen to keep in the house. And if an attack begins, start taking oxygen, at least by nasal cannula, if not by mask, at a rate of at least 3 liters per minute. Breathe in your nose, out your mouth, suck in all that extra oxygen. It could be the difference between life and death. Well, everybody, I just wanted to go over this all with you. If you have questions about sickle cell anemia, you're welcome to email me at ozonedoctor. That's OZONEDOCTOR at yahoo.com, YAHOO.com, ozonedoctor@yahoo.com. Remember, if you wish, you can call my office at 212-581-0101. We're in Midtown Manhattan, right by Carnegie Hall. That's 212-581-0101. Everybody, stay safe, stay healthy, stay well, and thank you for listening to me. And very important, please subscribe. Please tell your friends to subscribe. Okay, when you listen to these shows, I told it's an easy thing to do. I'm the opposite of a techie, but please subscribe to our shows and tell your friends about it. Everybody stay safe, stay healthy, stay well, and we'll be back soon with another segment of Functional Medicine with Dr. Robbins. Bye now.